Hi, my name's Jessie Phil. I am an LPN working out of Red Deer Emergency. I am the Local 44 Nursing Care Chair, and I'm also sit on the negotiating team.
Hi, I'm Mark Olson. I work at Centennial Center in Ponoka. I am on the Local 57, Chapter 3 Executive as a Secretary, and I work for the area council here too.
So we're here in Centennial Center in a gymnasium having a barbecue for the members. All of a sudden, these people in big suits and beautiful shoes show up, and one of them was the Minister of Mental Health and Addictions, who introduced himself as Dan Williams. He wanted to stop in and say hi and meet and greet all the people. Well, I asked him what's going to happen with Recovery Alberta. Why isn't the negotiation for the transition going well? And he basically gave me a lot of non-answers, saying he didn't want to get his political side into it, and just totally sloughing me off, totally ignoring everything that I said.
And so I asked Dan Williams, what is the structure of this going to be? How is this going to affect my life, my job security? And he responded with the same non-answers he gave Jessie. He gave me the same boilerplate. We have a commitment to you. But when asked, what are the details, can you give me a sheet of paper that tells me what my job is going to be, how I'm going to live my life, how I can plan my future? He has no answers for me at all. Extremely stressful. This isn't an interview. This isn't being offered a new job, a promotion, anything like that. This is being told you're being traded. Yeah, like a hockey player or like Cap. I don't know if I'm going to get paid the same in 6 months to 2 years, or if I'm going to work for another employer, if I'm getting laid off. I'd love to make a decision about my future. These are all things that could happen, but they don't seem to know. I don't think they know enough to care. I don't think they care enough to know. I think this is about things far beyond what happens here in the hospital. This is about winning a political war and not about patients, not about staff, not about normal people living in Ponoka.
Basically what you're hearing from my friend here, they're afraid, they don't know how to plan their life, they don't know what to do with their families, and there's a lot of misinformation out of there, a lot of confusion on what's going to transfer over and what's not going to transfer over. There's a fact sheet that AHS put out about this Recovery Alberta transfer, but there's a lot of mistrust with the employees. Nobody knows what's happening. I don't even think the government knows what's happening. They're just throwing this out there, like you said, to win a political war. They're not, and with them not being willing to negotiate a layoff recall with us, that means if they don't like Recovery Alberta, they have to quit and reapply with AHS. That means they lose everything, and that is not fair for people who have worked for AHS for 20, 25, 30 years. Why should they lose everything when they're not even giving the choice to who they work for?